CPR stands for cardiopulmonary resuscitation. It has the potential to keep people alive until emergency services arrive. Learning this simple life-saving skill is as easy as doctor's ABC. All you have to remember is the doctor's ABC. If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. In this video, I'll show you what to do if you've found someone collapse. We can use the initials doctor's ABC to remind us of the steps we need to follow. These initials stand for D is for danger. Before approaching, take a careful look around to ensure the area is safe for you and others.
Sure, right?
Yan. Yan.
R is for response. Introduce yourself as you approach. In order to elicit a response, ask them questions.
Sure, right?
Yan. Can you hear me? Yan.
If they are not alert and do not respond to your voice, ask them loudly while gently shaking their shoulders. If there is no response, you need to
Lawrence, call 911. And if you find an AED, bring it with you. I might need your help.
S. Shout for help. Call for assistance if the casualty is not breathing normally, as any assistance will be helpful. Send someone to call your local emergency response number or call it yourself. If you have someone else with you, ask them to make them call. A is for airway. If the casualty is not responding, open their airway by placing a hand on their forehead and gently tilting the head back with 2 fingers under the chin. B is for breathing. Look for signs of normal breathing by looking, listening, and feeling. We must now check to see if they are breathing normally. We do this by putting our ear and cheek against their nose and mouth while watching their chest rise and fall. Make an effort to feel their breath against your face. If there is no sign of breathing, or if they are not breathing normally, we must begin CPR.
She's not breathing normally and doesn't have a pulse.
You sure right now?
No, she doesn't have a pulse. Go get the CPR mask.
C is for circulation. Circulation refers to the movement of blood throughout the body. And when the heart stops pumping, we must take over by pressing down hard and quickly on the center of the chest. Put the heel of one hand in the center of the chest. Then, place the other hand on top of the first and interlock your fingers as shown. Push hard and fast with your arms strengthened, allowing the chest to fully rise each time. It's important to push for 100 to 120 compressions per minute. These might sound a lot, but it does not require a lot of effort to be effective. If you have been trained, you can give 2 rescue breaths for every 30 compressions as this helps provide some oxygen. If you haven't been trained or aren't comfortable, simply continue with hands-only chest compressions. Sometimes we can add another step. D for defibrillation. Use AED. AED stands for Automated External Defibrillator. It is a safe and easy-to-use device that delivers a therapeutic electric shock to the heart as treatment for a victim in sudden cardiac arrest. If an AED is not available, keep compressions going until an ambulance arrives. So, remember the doctor's ABC. And if you have it, D for danger, R for response, S for shout for help, A for airway, B for breathing, and C for circulation. I've shown you the simple steps you can take to assist someone who has collapsed, is not breathing, or is not breathing normally. If someone collapses without making contact, assume it is cardiac emergency. Begin hands-only CPR immediately while someone else dials 911 and gets an AED if you have to. For each minute that goes by, there is 10% decrease in the victim's chance of survival. Be calm. Act fast. Push hard and fast across the middle of the victims and do not stop to give breaths. Remember, doing something is always better than doing nothing.